We're here at the Calhoun County Chamber of Commerce with candidate for Alabama House District 29, Jared Millican. Jared, tell us a little bit about yourself.
Well, I am a native of Etowah County, grew up in Gadsden, Alabama, the Alabama City region, with my parents, Donna and Alan Millican. My father was the retired presiding circuit judge for Etowah County for the last 18 years. I am married to my wonderful wife, Jessica, who is most definitely my better half. We have a set of 8-year-old twins, Colin and Ella Millican. And I have worked, lived, and loved in Etowah County my entire life. But I branch out and I work all over the state now with the job that I have with NCR. And I just want to give back to my community. I mean, I'm running for that whole specific reason, and I think that everybody in our district should step up and try to do what's right in their community.
Thank you. We'll get to our first question now. And the first question is related to infrastructure. With the infrastructure challenges facing the state, what are your solutions for infrastructure issues, and how would you fund them?
We need to take a hard look at our infrastructure, because without that proper infrastructure, you can't court jobs. All of the problems that happen in our state are kind of wrapped together, from building roads to high-speed internet, bridges, things like that we need to desperately repair to bring businesses here in Etowah County and here in Calhoun County. To pay for those problems, to fix those, I'm up for any idea. One of the ideas that's been batted around some is raising the gas tax. We haven't had a gas tax increase in a really long time in the state of Alabama, and I hate taxes. I'm not a tax and spend Democrat, but this federal government is real funny about how they give funding out and how they match funding. So in order to get match funding, you may possibly have to do that.
Okay, thank you. Our next question deals with opioids. While prescriptions for opioids have fallen nationwide since 2012, Alabama still experiences a high rate of opioid-related prescriptions. In 2016, there were at least 1.2 opioid prescriptions for every individual in the state, and an 82% increase in deaths from overdoses between 2006 and 2014. What potential measures do you support that might help mitigate this crisis?
This is a very complicated issue. It's hard to answer in that limited amount of time. We need to take a long, hard look at the way that we treat drug offenders. Sticking them in jail you can't just stick them in jail and wish them away. We need to get down to brass tacks and actually come up with an actual statewide plan for a system that actually works, not just piecemealing it out to different places around the state so that we can, this method doesn't work or this method works. And I'm not saying that every method, there's one standard method that will work for every person that is addicted, because I've had friends die with a needle in their arm, so I understand that there's not always a fix for that. But we've got to come together and try to figure out some standard of care for these people besides locking them away and throwing away the key, which is what a lot of people think is necessary, but that should be a last resort issue. We also need to fully fund our healthcare system here in the state. We need to take the Medicaid, Medicare expansion. We need to make sure that we're taking that money. We left it on the table. I mean, that's just money that's sitting there. We need to make sure that we do that to help fund for those people with addiction issues.
Okay, thank you. Our next question goes to budget. What next year, with the budget considerations, what are your priorities and how would you fund them?
Education. Education is something that is the cornerstone for every civilized nation, and we don't do it the best that we can here in the state. Education means paying teachers a living wage. It means making sure that our schools are funding and that our parents aren't having to pay even more. My kid just had to sell chocolate bars so that the school had more money. I don't necessarily agree with that. I understand why they do it. We need to education lottery. It's not the fix-all. It's not the solve-all problem, but we're literally the only state. All the states that surround us now have one, including Mississippi. We need to look at that and figure out how we budget so that we're not spending money on useless, frivolous things in the state of Alabama.
Thank you. With declining population, what are your views and ideas on how to turn that declining population around?
You know, we just had this conversation a few moments ago out in the hall, and we're hemorrhaging. It's slower now. I think the key to that is good education, good jobs, and good living. Now, we live in the South, so we got good living. We got good hospitality. We've got good people. We need those jobs, and we need that education. And we have good education here as far as the college level. We do. We have some of the best colleges in the nation. But families want to come here and make sure that their children are getting the best education. And then, along with the infrastructure I spoke about earlier, we need to make sure that we're updating that so that we're bringing businesses in. If we have good jobs here, people will want to move here because the cost of living is so low.
Thank you. What are your solutions to help provide necessary resources to help Alabama's current and future workforce needs?
Ooh, this is a great one. I love this question. We need to make sure that we're training for the jobs that we have. My parents stressed to me, and it was a generation thing, that you have to go to college, you have to go to college, you have to go to college. I would have been better off with a trade. I would be making more money, I would have less student loan debt that I have now, and we need to make sure that we're pursuing that for children that cannot go to college. We need to implement free two-year college in the state. I know it's a big expense, but a lot of the states that surround us now already do that. There are ways around that to help with those jobs that we need. We need to bring back the apprenticeship program in high schools and make sure that every high school has that ability to train their students. You can get a certification for a master plumber, master electrician, master welder, pipe fitter, all those things that are union jobs in high school, so that when you graduate, you have that job. And if you still want to go to college, that's how you pay for it. You don't have to borrow money. You can actually put yourself through college on that kind of money. That is a huge thing in this state. We have a lot of jobs that people can't work right now because we don't have the skilled labor force, and we need to really push on the skilled labor force here in the state.
Thank you. The next question that we have is, what measures would you support to better stabilize hospital finances in order to prevent future hospital closings? I'm going to be honest and tell you I'm not 100% sure how to fix this problem. Because we're losing so many people in rural Alabama, it's hard to justify a lot of these places staying open. We definitely need to take the Medicaid expansion, just like I spoke before. And we need to work with our federal representatives to help with funding on the federal level to help keep those hospitals open. I am fortunate, just like you are here. Y'all have, I believe it's not regional medical, yeah. And we have Gadsden Regional and Riverview, which is strange that we have two hospitals in such a small town, but and I don't foresee those closing anytime soon. They're a metro area, so I don't live in a rural enough place to have that problem, but I definitely see it as a problem. You should never have to wait, 45 minutes to get to a hospital, when it's an emergency. So those smaller hospitals are definitely great for those smaller communities. I would be willing to hear any idea and work with anybody to help keep those hospitals open. Okay, thank you. Now, Mr. Millican, with just about a minute, take a wrap up. Any questions or any things that you had answers to that you had thought of something else you'd like to say, or anything you would like the voters to know in your closing remarks? I
want to go back to the opioid crisis. Like I said, it affects us all. The state defunded a lot of our, through budget cuts and things like that, about how we deal with mental health. And it got pushed over to our local municipalities, city and county. We really need to work on this with our law enforcement officers. They're the huge key to this thing. Like I said, you can't just lock them up and throw them away. We need to work on rebuilding our mental health, rebuilding facilities for people for mental health. We need to work on all of that and combined. I think that accountability also is a huge issue in government today. And I will be a very much open door policy politician to make sure that the needs of all the people around us are met. I will never not listen to my constituency because that is basically my employer if elected.
Thank you. Mr. Millican, we would like to take this opportunity to thank you for your willingness to serve at the Alabama House District 29. Should you be elected, we appreciate your willingness to go through the process and come in and answer these questions today.
Thank you.